Alright, this video is going to cover what is functional impairment. So, functional impairment is a health condition in which the normal function of a part of the body is less than full capacity. So, there's a wide range of the types of impairments. So, it could be something that's mild, that might involve slight eye loss, slight function of the eyes, or it could be considered a full disability. So typically, while it's usually referred to physical limitations, it can also be evidenced as cognitive or emotional limitations as well. So the signs of a functional impairment, they typically include the manifestations in some sort of decrease in the ability that is noticeable by other people. So let's just to give an example. It might be the inability to make a fist or to grip objects that in the past might have been really easy and you could easily grasp it securely. As it relates to emotional issues, things like the development of depression, phobias, or anxiety disorders, those are all conditions that may be classified as impairments, along with the diagnosis of dementia or some other type of mental illness. One of the defining characteristics of functional impairment is the reduction in physical or mental capacity, and that it's sufficient to interfere with managing day-to-day tasks. That's key. So if a individual person they experience very severe nervous illness, and that in turn leads to the development of agoraphobia, which is that individual's ability to work outside of the home or participate in such activities as eating out or going to a social event, things like that, it may be significantly diminished. So when that occurs, the functional impairment of the individual is considered somewhat high. So identifying the presence of a functional impairment, it's going to be important for a number of reasons. From a medical standpoint, properly assessing the type of impairment that's present makes it easier to identify the most beneficial course of treatment for the patient. So medically, you want to identify what that impairment is so you can treat it and do what's best for that person in that functional impairment. Also, from a legal standpoint, the assessment of impairment is often necessary to determine if the individual is entitled to disability benefits if they're older, or what accommodations they might need if they are a student. So it depends on the nature of the events surrounding the functional impairment. The condition might be considered permanent or short-term. Some forms of mental or emotional debilitation can successfully be treated with therapy or medication, and those will allow the individual to slowly reduce the level of impairment and reclaim their life, and those day-to-day tasks will become easier if the therapy and medication, things like that, are successful. In some cases, that involves some sort of permanent physical change, perhaps a loss of a limb or some level of impairment that may remain for the remainder of that person's life. Although the degree of the impairment might change as new skills might be developed to compensate for that loss of whatever that functional impairment might be.